Well, you may not know what your Eustachian tube does, but you'll certainly notice if it's not working the right way.
ENT Consultants has a procedure that could help.
Yeah, good morning, doctor. Good to see you. Dr. Medeiros is in this morning.
Good morning.
It's always a pleasure to have you in here, Samuel Medeiros, because we're going to be talking about this, the Eustachian tube, and maybe it's dysfunction, right? What is the Eustachian tube?
The Eustachian tube is a tube about that long that goes from the back of the nose to the middle ear, and people know when it's not working. If you've ever been on a plane flight, even if you think you've got perfect sinuses and ears and you've had trouble clearing your ear, you have an inkling of what people deal with that have Eustachian tube dysfunction every day. And if that never works for them, it's that awful pressure and sometimes fluid in the ears. Yeah. We think about it in kids a whole lot. You kind of worry about that crying baby on the plane, but it happens in adults too. And so now there's something for adults who aren't going to grow out of it.
Now, does that feel kind of like maybe an ear infection?
It can lead to ear infections, and to some degree you can think an ear infection is to a level certainly Eustachian tube dysfunction, but it doesn't have to be that painful. It doesn't have to be at the level of infection for it to be a problem.
So if you just ignore the pain and let it go away, as many of us tried to do for a while, what are some of the complications if left untreated?
You can get that negative pressure in the ear all the time, can actually suck on that eardrum. And it's living tissue. That eardrum sometimes will stretch.
That sounds painful, suck on that eardrum.
No,
it never feels good to begin with. The more it stretches, actually, the less painful it is, but that's not good for a variety of reasons. Your hearing gets worse. It can actually create little like a cyst in the middle ear area that can be a bigger problem surgically. But a lot of times it can pull fluid into the ear, and that's when people get that underwater feeling, and that hurts hearing, and again makes it more difficult to clear your ear when you're changing altitudes or just when storm front comes through is miserable too.
At ENT Consultants, you guys have seen this hundreds and hundreds, probably thousands of times.
Yeah.
There's some medicines out there, right, to help treat this. And are there other options out there, maybe surgical options?
Yeah, I mean, people have done nasal steroids, which about 15% of the time fix if it's a long-term problem, so it's not awesome. I use decongestants and nasal sprays and pills. And until this, we kind of had tubes, which we do for kids all the time. That was an option for some adults, but it was not a great option because, 2 years later, a year later, they're back for it again, and that's kind of a repetitive issue. So there is a new procedure now that's showing up there where we have the ability to actually fix the Eustachian tube and not bypass it by putting a tube in the ear. Right. The idea behind that is stolen from originally all the cardiology balloons, and then we've used them for sinuses now for a while, and now as of November, it's been FDA approved to be used. We still sneak through the nose to get to the back. That's where that tube enters. Everybody knows when they are trying to yawn and get that ear to clear. And so that's the side we enter in on. It's not super safe to enter from the ear side. We have plenty of room on the nose side. And exactly, this balloon then kind of comes up the Eustachian tube and it gets into the middle. It doesn't quite get into the middle ear. It's got a safety stop because we don't want it to go quite that far. So it goes to the cartilage portion there that you're seeing in the white. It stops before it gets to the bony portion, which is just the last little bit.
So we're going through the nose to the ear. This is very intriguing.
That is fascinating.
This is a safe way to go through it. And then it'll dilate this open. These balloons are kind of amazing. They hold, that's 12 atmospheres it's showing there, so it's like 14.7 PSI per atmosphere. So you can just imagine we're like 170 something PSI. Your tire holds what, like 40 if you got a big tire?
And that's the actual tool right there that you're holding.
This is it, yep. And that balloon kind of sneaks up through here.
So it's very
look how small it is on the end.
It is, yeah. We're not talking about a big space.
Now, can people feel the discomfort of this? I mean,
at the moment, it's okay to the FDA.
So now it's inflating.
Yep. So that's getting up to close to 12 psi. At the moment, it's only approved for in the OR. That's what it was. That's how it's been FDA approved. It's obviously the goal in the future is to be able to do this in the office. It takes quite a bit of numbing medicine. Typically, we don't get any bleeding. We finish this whole procedure. This balloon stays open for 2 minutes by the clock, which would be the uncomfortable part in the clinic. But we typically don't see any bleeding at the end of the procedure. It works well. We get sometimes fluid come out of the ear immediately.
Should we try it? You want to see what it feels? Let's see what it feels like.
Let's demo this
Just
thing,
stay still. I didn't bring any anesthesia, but it'll be all right.
No anesthesia, no problem. But what are patients saying about this?
We've had good results so far. It's been available since November, and I happened to be the first one to do training in the area because it was Veterans Day. I was going to take it off anyway, so I kind of snuck up there. I did the training, and we've done 30-something of them, so obviously not a ton, and it was a 5-year study that got it approved. About 60% of people were seeing this as a good long-term fix, and these are people who've dealt with it. I had a guy the other day, had fluid in his ear for 8 years. He'd given up on tubes. He'd had them 3 or 4 times. He's in his 50s. 2 weeks, 3 weeks later, he was doing great. It was a better long-term fix for him.
Wow.
And we've so far been on the high side. We've had a lot more than 60% of people say, hey, this has been a fix. And they say up to 75% of people symptomatically, even if the way we test says, oh, it's not perfect, they still say, you know what, I'm better than I was. I'm happy I did it.
Well, any additional options out there, people are going to try it, because I've had an issue where I had an ear problem where I couldn't hear very well out. I felt like there was water in there. Took a flight to California, and for 3 days, it just made things, it compounded things, it made things really worse.
This is a nice answer.
Yeah, OmahaSinus.com, that's where you can find him. Dr. Medeiros is there at ENT Consultants. Just give him a call right there off South 144th Street. Doctor, thanks for coming in. That's a fascinating tool.
Thank you very much.
That was very cool to see.
Yes,
Thank
thanks.
you. Well, it only comes